Good morning. Good morning, everyone. I'm Reverend Mark Hughes. I'm the Executive Director of the Vermont Racial Justice Alliance, and we're here at the Richard Kemp Center. We're live for a press conference that we promised you yesterday, and what we're here for is the immediate release that you saw yesterday was regarding the governor's office, the cannabis board, and the media's essentially failure to listen to meet the needs of the regulated cannabis industry, the medical cannabis program, as well as communities impacted by criminalization of cannabis. So we thought we would make a statement. The bill is H.321. It's on the governor's desk right now. I do apologize for the delay. We're having some technical issues, and we were trying to figure a couple of things out before we started today. Thankfully, we don't see a governor's action on it during that time you were waiting. I know it was a little bit of a time there, so we do apologize. The leading cannabis legislation during this session, 2025, was H.321. And this is an act related to Miscellaneous Cannabis Amendments, and that's the one we're going to be talking about today. Today I'm joined by our Cannabis Equity Coalition. It's going to include some comments from rural Vermont, from Vermont Racial Justice Alliance, Green Mountain Patients Alliance, and the Vermont Growers Association. So we'll have a few comments. What you'll do is you'll hear from each one of those, and then I'll be rounding things out. What we know right now is that there's, as far as the economic justice piece, community reinvestment, and just the work that we've been trying to get done on the medical front and even on the ag front. We've been trying relentlessly over the last probably 4 or 5 years, just trying to move policy so the little folks will benefit from this market, and just to be able to slow things down a little bit so we can, so folks can take advantage. Also, to be able to address some of the harm that cannabis has caused, and so looking at things like community reinvestment, and also the Cannabis Development Fund and its viability and its sustainability, and we just have not really made a lot of progress. We've just been faced with recalcitrant opposition. So we're going to talk a little bit about that today. You'll hear from these folks, and hopefully the governor will hear as well. And if you hear something you'd like the governor to know, you're welcome to call him as well. So with that, I'm going to go ahead and introduce. In what order are we going in, Jeffrey? It doesn't matter. Okay. So how about if I start with Jessie Lynn Dolan, and Jessie Lynn is from Green Mountain Patients Alliance. Thank you.
Thank you. Thank you, Mark, and thank you for everyone being here today. This is about opening a conversation that we feel is long overdue. As Mark said, we have tried year after year to have our voices heard, and unfortunately feel that those have fallen upon possibly deaf ears. So we're here today to address some of this. So definitely open to questions. But again, thank you for listening to us. This is what we've been trying to do. From the medical perspective, the first thing I will mention is that medical often is squeezed into all the other meetings and the other bills. What we would really like to see is medical to actually have separate time to meet, and legislators to work on creating bills with us to really change and advance the medical program. Since the inception of the adult use program, we put little to no effort into the medical program, and unfortunately that's the history of the program's evolution as well. So we would really like to see a few things that we've been asking for over and over come to fruition. Things that we've been in agreement with the Cannabis Control Board on, and they've also advocated for. One example is to establish the Symptom Relief Oversight Committee, which is a committee we had for years, allowing patients, caregivers, and healthcare providers to have voices and to discuss the topics and changes we need to see addressed. Unfortunately, we're seeing some of the opposite happen. With CCB policy, medical professionals are not allowed to be in adult use facilities or dispensaries, helping supporting our most vulnerable patients that need the education and support from medical providers. We also have requested to have symptom eligibility moved to the Cannabis Control Board themselves and out of legislators' hands. Cannabis Control Board also agrees and has advocated for this. We've been looking at medical program funding and requesting to reinvest some of the patient's own money into the medical program for some of these advancements and changes that we know need to happen. We also are looking at the adult use community being able to serve medical patients with a medical use endorsement coming up soon. With that, there has been recommendations for an enhanced medical educational program, one that we do not necessarily stand behind because of some concerns that we have, from transparency to lack of regulation, and recognizing that most of our consumers that are new or coming to cannabis needing support and education are older patients who do not necessarily look at an app as the way to provide education. So really what we're hoping, again, is to open up a conversation. Several things we've been talking about for years that we've been testifying for multiple times this session, just unfortunately have not been as heard as we'd like them to, unfortunately, be addressed, and are hoping to bring that today. We support the Vermont Cannabis Equity Coalition and their efforts, including on-site consumption, direct-to-sales farmer, the social equity programming that we've been asking for and advocating for, as well as changes in ag policy, which will all make it better and safer and more accessible for our patients, which are our most vulnerable Vermonters, and often the reason why we have an adult program to begin with. So thanks again. I'm going to pass it off to Graham from rural Vermont.
Thanks, Jessie Lynn. Thanks, everybody, for being here today. So my name is Graham Unang-Strufenacht. I am the policy director at an organization called Rural Vermont. This is our 40th year. We are a member-based, not-for-profit organization based in Montpelier, but we are also statewide. We are one of the larger membership-based agricultural organizations in the state. The Northeast Organic Farmers Association of Vermont, NOFA Vermont, is also a member of the Cannabis Equity Coalition, though they're not here today. And I want to say we understand that there are significant challenges needing to be addressed statewide. School budgets, property taxes, healthcare. When we look nationally, we have over 700 Marines going to the streets of LA to be weaponized against civilians. A lot of these issues are going to rank at the top of a lot of our lists. But everyone wants and needs their concerns heard and addressed, including the struggling Vermont cannabis industry. Why are we here? Because we need to call attention to the problematic ways cannabis is being treated by the Vermont Legislature and media, and the Cannabis Control Board. As I told the Senate Economic Development Committee, our proposals have the support of membership-based organizations representing thousands of Vermont residents. We have more direct stakeholders of every license type supporting all of our priorities and language than any other proposal on the table. We have more organizations and businesses behind us than any other proposal. We have the CCB's very own surveying of Tier 1 cultivators and its mandated reports attesting to many of the priorities we have. We have worked to bring together disparate actors. There is no other proposal which is more representative of the Vermont public and the direct stakeholders involved, and no proposal that has been more vetted. So despite these things, the question we're here today with is, why aren't we being listened to by the legislature or the media? These are some of the questions that I have, which I think are important for the media to ask and the public to understand. Why is this broad coalition of membership-based, not-for-profit groups and allies, and most of the stakeholders and their priorities, not being reported on? Why are other misleading narratives, such as oversaturation, being focused on? Why is it acceptable that the state is profiting off of cannabis without working to repair harm it caused through criminalization? Why is it acceptable that only people who own their own homes or land can legally consume cannabis? We had a outdoor cannabis producer giving testimony. She lives in Section 8 housing. She's renting land to produce on. She has nowhere to legally consume cannabis. That's a fundamental inequity I haven't heard anything written about. Why do producers need to operate in an exclusively wholesale market in which they immediately lose half of the value of their labor and agency over their product and production? Why are medical patients and providers ignored year after year after year, and sidebars to adult use regulation conversations? Why are regulations for alcohol and tobacco far more strict than those for cannabis? Why do we have multiple reports and surveys commissioned by the CCB or mandated by the legislature which are being functionally ignored? As a farming organization, in November, I was able to say at our annual meeting that over the last few years, we have seen more than 250 new farmers in one particular sector of Vermont's agricultural economy come into regulated space. That's outdoor cannabis producers. I will not be able to say that at this time, this coming November. Many of these farms and farmers will have been put out of business by the regulatory system itself. Now, you may not actually see these as farms or farmers. They wouldn't show up in the Vermont census data because these producers aren't considered farmers. I rarely see them treated that way. The product they produce isn't considered agricultural. They can't produce on land in the Vermont Land Trust. They can't produce on land which is part of an NRCS contract or on land the tenure of which is funded in any way by the federal government. They are audited multiple times a year by multiple entities, and they pay thousands of dollars for insurance and banking and basic administrative costs. Amidst these unreasonable burdens, they can't even sell their product directly to consumers, meaning they are mandated to immediately lose half of the value of what they produce to someone else who will capitalize on the value of their work. We know that small farms and small farmers cannot survive without direct sales and without direct relationships with their customers and communities. In a recent Vermont Public story, I heard it reported that the legislature rejected an event proposal in H.321 because they didn't want to, quote unquote, support more cannabis use. Well, I've got news for them. They've already decided to support cannabis in Vermont. You are regulating cannabis in Vermont. The question is whether or not you will create an equitable and accessible regulated economy in which local small businesses and producers can have thriving and viable businesses, in which consumers have free choice to access their farmers and producers. I'm wearing a Vermont Growers Association shirt here. It says support your local grower. You can't support your local grower. If you want to get a product from a particular producer, you're going to have to go to some store somewhere in the state that may or may not find, you might be able to find it. You need to create a system in which medical patients and providers will have a voice. And lastly, legislators need to choose whether or not they're going to profit from this regulated market with or without recognizing and reinvesting in the communities they have harmed over time. H.321 functionally divests the state from our social equity program, the only one in existence, the Cannabis Business Development Fund. And they continue to refuse to invest money, reinvesting in communities that have been harmed by cannabis. That's why I feel we're here today. I thank you all for showing up. Jeffrey?
Excellent. Question time? Question answer time?
Did you have anything to say?
No, I think, yeah.
You good?
I'll let you.
So, I want to talk a little bit more on the equity front. Mostly because it's, what we're really dealing with is these issues are interlinking. When we talk about equity in the cannabis industry, in the cannabis market, we can't do that without talking about housing. We can't do that without talking about economic equity as well. We know that winners in this market, they own land and they have resources. I just wanted to flag just a couple, maybe we don't talk about it enough, but Graham just mentioned something. I just want to sit on this for a minute, and that is that within this market, when you look across what we've done towards the Cannabis Development Fund, that's this in support of the social equity applicants, we've never had a sustainable fund, a cannabis equity fund. Neither have we ever had one that has been sufficient for the volume of social equity candidates. So that's never happened. We've always had a law on the books that allowed roadside testing, which still exists today, although the technology, the efficacy of the technology is horrible. We know who road stop testing impacts more, certain people who look more like me. We also know, as Graham had indicated, that we have a legalized market. We have a market where folks are actually permitted to purchase cannabis, but literally they have no place to consume it. Think about that. You can purchase. There are many people in the state of Vermont who can purchase marijuana, but because they don't own a home and they have to get permission from their landlord, which more times than not is probably not going to happen, they literally have no place to consume it, which opens them up for here we are, full circle back to legal recourses. So there are many, the market is riddled with inequities, and there has never really been an earnest effort from legislators to actually address that. And as we are moving forward with this market, it seems as though, in my opinion, that H.321 just perpetuates the harm, and it perpetuates the systemic oppression. And what it's doing is it's causing this market to become what we view as more of the same. That is, just like any other market that perpetuates harm, that perpetuates systemic oppression, that perpetuates a system where there are some who can do really well, and there will always be others who cannot. So that's the challenge that we have with this policy. We don't feel as though we've had good faith partners in moving forward good legislation that would benefit those who cannot come and fight for themselves. So the bill is on the governor's desk. We are looking forward to see what the governor does with it with anticipation. We are really disappointed that we put so much work in this session to try to get this work done, to try to advance this policy. And at the end of the day, and I will speak about process, it seems as though the process collapsed on us, and there was the stakeholders, legislative and regulatory stakeholders, essentially turned inward and shut us out of the process and moved forward something that we really didn't sign up for. So we just feel like this policy, I think most folks on this coalition are essentially indifferent about the policy, and some of us would just like to see it killed. So with that, Jeffrey, did you want to open it up for questions?
Yes. Why don't we start with members of the media that are in the room with us? If you guys have any questions or comments?
So ultimately, would you like to see the governor veto this? I think it faces a deadline of next Wednesday, I believe, something around there. I mean, would you like to see him veto this?
One thing I will say about the bill is, to me, it's very telling as to us not being listened to, unfortunately. Everything the bill started with that we felt was substantial and supportive has been stripped, and the remaining bill that we do see left is not a bill that we feel is going to support our efforts and the things we have been advocating moving forward. So if that means we don't want the bill to be passed and we want to see it vetoed, that could be possible for many of our feelings, but I will reiterate that I do feel the bill is very telling as to what it has not addressed and the things we have not, unfortunately, been listened to and have not moved forward in the direction we want to see.
Well, I just wanted to respond in the sense that I just would encourage folks not to get too distracted by H.321, because there's really not, as the chair of the Cannabis Control Board said in a meeting with us earlier this year, there's nothing in it for the Vermont cannabis industry, and that was before it was stripped to bare. So for us, this is really about our 5 years of advocacy, including this session, being the predominant voices in the room, being the most representative coalition out there, and continuing to get nothing, to continue to get very little in legislation. And this piece of legislation is just another example. It was stripped at the end, so it doesn't have anything with extremely negative impacts on the industry, based on my understanding. At the same time, it doesn't have anything of importance to us. So that's why I don't want the bill to be a distraction. From my personal perspective, I want to see the processes change. I want to see a new committee of jurisdiction in the House. I want to see legislators start to listen. I want to see media coming to groups and individuals outside of the State House to stop telling the accounts of power and start holding power to account.
You mentioned a change in the relationship, or you were having, I guess, a seat at the table. When we were building the marketplace a few years ago, I remember your organizations were really heavily involved. I mean, what changed in that time frame from 4 or 5 years ago to today, do you think?
Jeff, do you want to say anything around this? I can.
Yeah, I didn't catch that. Sorry.
I can start. No, there was a question about sort of our involvement from the beginning with this advocacy and how much we were or weren't getting. I think if folks will remember correctly, S54 was the enabling legislation of this entire industry, and our coalition asked the governor to veto that legislation. Most of the priorities we have right now, we feel are foundational, from public consumption to social equity to reinvestment in communities harmed to direct sales. To us, there wasn't going to be an equitable market until a number of those things were included in it, and we did not support even the market coming into formation itself without those foundational aspects of equity. So part of my response to your question is that we didn't get a lot of what we were asking for in that formation discussion. And I know many of us, different organizations, started well before 2018, 2019. Rural Vermont worked on hemp for years. We worked with the Agency of Agriculture to support the program here. We've worked nationally to support hemp. We got involved with this based on a number of priorities and principles that we carry as an organization and just the intersectionality of this issue.
I'd say nothing. I'd say if the question is what's changed. We as Graham said, we started this work out not being listened to, and we haven't been listened to since. So, but we haven't stopped trying, and we won't stop trying. What we'd like to see is some structural change. The question, I think we might be asking the wrong questions. I know reporters hate to hear that, but the question ought to be, what can we change so we can get different outcomes? Because we've been fighting really hard. We've been working really hard to get some outcomes that benefit the least of us, and that don't just, again, expand the market. And the market's a boon right now. Last time I checked, the numbers were pulling down maybe $10 million a year or something like that. $20 million a year. So the market's a boon. So it's not a problem. It's not like we're not making money here. The question is who's getting paid. And who's the market benefiting, and who's it hurting? And I think those are the questions, if I could be so bold.
And I would agree with Mark from the medical perspective. From the medical perspective, not a lot has changed. We've been advocating and asking for change for as long as I can remember, going back before we were even discussing an adult use program. Even the example of legislators mandating a medical report being done this past year by Cannabis Control Board involvement and guidance that has not really been addressed this year. So unfortunately, I don't think a lot has changed. We're still continuing to fall on some deaf ears. In the medical field, it is a bit of a gray area as to what medical professionals can or cannot be doing and involved in cannabis. But luckily this year, we have found a little bit more guidance with that, knowing that medical professionals are allowed to be involved and educate in cannabis. But again, I think that's part of the question that has been up in the air, which we are teasing out. But due to that, unfortunately, medical professionals are not currently involved in the medical cannabis or the adult use program very much. So thank you for the question.
One more thing I would like to say, in all fairness, to give it a shout out to the Senate Agriculture Committee and Senator Starr before he retired, because on the agricultural side of things, with outdoor, in terms of outdoor cultivation, that committee did assist us in making some gains around aspects of agricultural status for outdoor producers. But I would say that is one of the very few places we've seen any progress. And then we saw a year after that regression again, where now municipalities were giving new zoning powers over outdoor production. With a court ruling a week and a half ago, we're actually confronting a whole new potential realm of municipal authority over agriculture more broadly.
Okay, are there any individuals, members of the media, that have connected over Zoom that would like to ask a question? Bob, go ahead.
Yeah, I'd like to know if I can Alvin's question about the veto. Is your message to the lawmakers and to the governor, this bill is lousy and doesn't address the needs of the industry? It should be vetoed. Or is the message, let's build upon this bill next session to address the priorities that we have?
Can you repeat some of that?
Bob, would you mind repeating some of that? I think we caught most of that.
Actually,
Oh,
that's not loud enough for me.
okay.
The question Bob is asking is, are we looking for the bill to be vetoed or not?
And I think that to qualify, he was saying, are we telling the legislature this bill is bad, we need to veto it now, and or do we need to build off this bill more in the future to make things better? Someone want to start with that? I know you're eager to.
Everybody's scared of that question.
I'm not asking. I think we just answered that question.
No, yeah, I think yes. The answer, Bob, is yes. The answer is yes, absolutely. The bill should be vetoed, and we should build upon the bill so we can make it better. I think both things we could say that both things could be true at the same time. What we know is whether the bill is vetoed or not, it should, we should build upon it. I think there's a message that the governor, because I think I saw the governor do something very recently where he communicated to certain folks where he said stakeholders were not involved in this policy. And this is something that happened very recently, if you might recall, that the governor said, no, I'm not having it, because this is not how I govern as a governor. I'm not going to allow this to go forward because I'm not confident that the stakeholders who were involved in this had a voice in this process and that it was listened to. So for reasons like that, of course, yeah, that would, and I think in places where there are folks amongst us who might be on just kind of like teetering on that, whether or not it should be vetoed, they are yet indifferent about the policy itself. It's that they don't care. My personal position is if I don't care about a policy, then that means in a situation like this where we've had the opportunity to participate and yet not feel as though we've been heard, then my indifference is indicative of just that. Yes, a veto. Now let me just say this last thing though on this whole thing about vetoes is that it should also send a message to the legislators. It should also send a message to the regulators. It should communicate to you the fact that there are some of us who are willing, at the end of the day, if having done everything that we can do to get your attention, not being able to get your attention, who might be willing to burn it down, who might be willing to just stop this thing and say, you know what, let's just scratch this and start over. And maybe that might be the incentive that you need to work with us. And I'm the one within this coalition that's willing to say that. So yes, and yes is the answer to the question.
And what do you exactly mean by starting over?
Thanks, Bob. It's so good to hear your voice, Bob. I hear you on the radio all of the time, and I'm just like, that's Bob Kinsel. Oh my God, this is great. What I mean by starting over is that we've got another year left in the session. Let's take what we've created. Let's not throw the baby out with the bathwater. Let's get back to work. Let's take it back down to the legislators and let's negotiate. Let's work together and get this policy right. So I guess starting over, maybe that might be I might have misspoken, Bob. Maybe really what I was trying to say is that let's take it back. Let's take it back to the sausage room and let's do some more work on it. Does that help?
Yeah, I just had one further question was, almost all of you have talked about that lawmakers have not listened to you. You've expressed your priorities and they have ignored you. Is that a matter of them, maybe this is a semantic difference, but I think it's a policy difference. Is it that they don't agree with you or they're not listening to you? I mean, could they be listening to you and not agreeing with the priorities that you have?
So like I said, our coalition itself and stakeholders we brought in were the predominant folks testifying before both the committees of jurisdiction and non-jurisdictional committees, such as the committees on agriculture this year and in past years, I would suggest. There may be opinions of difference, but what we found is there's a significant degree of bias towards cannabis in the State House. I think that's honestly part of my question. I asked a bunch of questions for the media at the start. One of them is, why is there this sort of circular narrative that lives between the media and the State House on this issue where these issues aren't being talked about? And I think I heard it in committee a couple times. Well, I heard this Vermont edition story or this Vermont Public story about this is where cannabis is at and this oversaturation thing. And I'm like, oh, so the lawmakers are hearing from the media, who's hearing from lawmakers, who's hearing from the media. And maybe what I'm pointing to is the fact that our narratives aren't being put out there. And what I'd like to ask you all is go to those committee pages, see who gave testimony, see whose documents are showing up there, and report on that. Don't go to the chair of the committee and say what they want to be heard. You know, don't go to the people in power and repeat those positions, repeat those issues. Come to the communities affected. Come to the stakeholders. Come to the organizations representing them. There may be differences of opinion, but this whole thing we're doing right here is just as much for the Vermont public as it is for the media and the legislature. The public needs to know that grassroots, not membership-based, not-for-profit organizations representing agricultural equity, racial justice, medical providers, patients, are not being listened to when we are the predominant voices at the State House. That is the question. So there may or may not be disagreement, but when the people who live in the state, who these representatives are supposed to be representing, are coming and saying particular things, and they're not being acted on, it doesn't matter if it's a disagreement or not. If they want to disagree, let's have the argument. Let's have the conversation. But whenever I've gone to a number of people in the State House and said, you know, we come with the best arguments. We come with with the communities saying these things. They say, this is the State House. Well, you think this is where democracy happens? I've literally had lawmakers tell me that. I literally had members of the CCB telling me that. So this isn't a question of having the truth. This hasn't been a question of having the most representative coalition. This hasn't been a question of having stakeholders who are giving the legislators their experiences and the inequities they're experiencing right from their mouths. This is a matter of how power is or isn't responding to those stakeholders. As Mark was saying, who or who isn't benefiting from this market. And I don't know why. I'm not here to speculate why. I'm just saying what I'm seeing happening. That's the best I can do.
Well, do you think this is, unfortunately,
Do you
I
want to
was
respond to
looking
that?
at Vermont Growers Association logo, so that was Graham who was talking?
Yeah, this is Graham, Policy Director,
Yeah.
Rural Vermont.
Yeah, so, somebody in the beginning said that some lawmakers, I'm thinking now of Representative Harrison, who, hey, his point of view was, we don't want Vermont to be in the business of promoting cannabis. And that might be hypocritical considering the way that Vermont promotes alcohol use. I'm wondering if you think sort of an underlying foundation piece here is that there is still a stigma about cannabis that doesn't exist with alcohol.
I would say absolutely. We need to look at the stigma. We need to look at both conscious and unconscious bias. This is something I deal with in the medical profession often, is medical providers not having the information and having misunderstanding. So what we need is legislators to have the education or to listen to us, to the people that do have the education. So yes, I feel this is extremely stigma-based. And what we also know, unfortunately, is that many legislators and many Vermonters would not even like to have a medical program. They don't even want us to call it medicine or medicinal cannabis because of that unconscious or conscious bias and stigma. So I think this is something we've been fighting against for a very long time.
Let me also respond to that, Bob, because I think just to think this through. First of all, I think the question is a really, really good question, and and despite the fact that there is a stigma, look, I'm a licensed and ordained minister, okay, and we're sitting here and we're having a conversation about cannabis. Come on. Is there a stigma? Yeah, there's a stigma. There's something else that exists as well that goes along with this stigma. Harm. There is harm that has been done by this drug, this weed, this medicine, whatever you want to call it, this stigma. So if we can park that stigma for 13 seconds and have a conversation about the harm that it's done historically and the ability that we have to address it. You know what else we can say about this weed, this drug, this medicine? We can also say, in addition to the stigma, that it's also creating revenue. So there's a lot of money that's coming from this so-called stigma thing that we're having this conversation about. And so what we, just like most responsible legislators do, is we want to direct those resources to the places where we can use them most effectively. And it seems like it would make sense to start with addressing those areas where it has historically done the most harm. So that's the only thing that we've been talking about legislators with regarding this whole business with equity. But yes, I just want to acknowledge the fact that yes, there is a stigma. There is a stigma. And yes, not to call anybody a hypocrite, but there are double standards or even triple standards, because we haven't even had a conversation about online gambling or the community that it most likely will impact the most.
And one thing I would love to challenge legislators, the CCB, the media on, is to open the conversation around advertising restrictions and the fact that we promote alcohol and tobacco very heavily. So we now have a very restrictive program in place with cannabis. That should be the same program we're following to protect our youth from tobacco and alcohol, or our cannabis regulations should be as minimal as they are for alcohol and tobacco, things that reportedly continually kill people and harm our children over and over.
Thank you.
Thanks, Bob.
Any other questions or comments from members of the media over Zoom for this moment? Please go ahead and raise your hand if you'd like to ask a question, deliver a comment. And then what about back in the room? Okay.
If you don't mind,
Yep, Riley, thanks for joining us. No problem. This is a press conference, so we do want to limit comments and questions to members of the media. Appreciate you all joining, and those who are not members of the media, thank you. Appreciate everyone following that. All right. Any closing remarks?
So we want to thank you all for coming out. Thanks for paying attention. I think it's an important policy. It's important work that's happening. I want to shout out the legislators. They're doing the work, but we could use we could use your support. We need you to lean in, legislators, regulators. Same thing. Need your support, Governor. You know what to do. And what we'll do is we will circle back around and debrief on this, and we'll come back next year with additional work on this. I want to go to you as well.
I just want to invite you all to come to us. If when you're writing your stories, when you're exploring what's going on around cannabis, come to the Vermont Cannabis Equity Coalition. Talk to us. Keep talking to other people you're talking to as well, but please come to us. Please look at the testimony that's been given at the State House. Please look at the documents people have submitted. Tell those stories. Those people are talking about white-knuckling it, the people who are in it. These are people who are really struggling, and they're telling their stories to legislatures, but it's not making it out to the public.
Jesse Lynn.
Thank you for your time, and I look forward to, in the future, addressing medical in a much more deep and impactful way, and support all the work of the Vermont Cannabis Equity Coalition, and as Graham said, encourage you guys to come to us, listen to us, hear our voices, use our words, and we'll work together to hopefully see some impactful and substantial change moving forward. So thank you.
Thank you. Have a great day.